In your health headlines, it is November, and November is Men's Health Awareness Month. And tonight's topic, one of the most common cancers in men that's treatable when caught early, prostate cancer. Dr. Mitchell Goldman, Dr. G from UCSD is here to talk all about it. Thanks for being here, Dr. G.
Always good to be here, Kathleen.
Well, prostate cancer is a men's health issue we hear a lot about because it is the third leading cause of death in men. So why is it so common?
Well, it's common because men have prostates, and with aging, the prostate actually can become cancerous. You know, there's a few other things that cause the prostate to become cancerous. One, interestingly, is genetics. So if your parents have it, you're more likely to get it. If you have a very poor lifestyle and don't exercise, you can do it. And then, interestingly, the race card. African Americans, for some reason that we don't know, have a higher incidence. So the older you are, the more family history, the less exercise, and being African American really puts you at risk.
And I know that early detection is the key with prostate cancer. I have family members who have gotten it and survived it, but symptoms don't come on quickly, do they?
No, and they're not entirely specific. You know, the symptoms that come on are basically difficulty urinating, having to urinate excessively, pain on urinating if you have blood in your urine or semen, and pain during ejaculation. Those are the key things. So it's so important to be checked over the age of 50, and especially if you have a family history or other problems. The way we check it is, of course, called a digital exam, where the doctor actually feels the prostate for nodules. The other is a blood test called a PSA test. And since we've been doing PSA tests, the incidence, not the incidence, but the death rate from prostate cancer has really gone down. Now, in California, this year alone, over 15,000 men will be diagnosed with prostate cancer, and over 3,000 will die. So it's very, very important to get your prostate checked, especially after the age of 50.
And Dr. G, like all cancers, there are new treatments that are coming about all the time. What are some of the options for people who are diagnosed?
Well, if you're very elderly, one option is not to do anything, because prostate cancer is extremely slow growing. But if you're not elderly, we want to try to get rid of the cancer. And so surgery is the number one, and it's actually, there's robotic surgeries and other types of ways to remove the prostate. Radiation therapy, either external or internal by implanting beads, is another one. But a newer form of therapy is called immunotherapy, and that's when we can actually take your own cells and literally turn them on to fight prostate cancer. And there's other immune mechanisms that are being developed right here in San Diego to fight prostate cancer. So even though 1 in 8 men are going to get actually 1 in 7 men are going to get prostate cancer, fortunately we have new techniques and new treatments that are coming out that are going to make this a very curable disease.
All right, and Dr. G, as we know, we have to go, but we're talking to women as well, because we usually are the ones that have to push men to go get these exams.
Wives save lives. That's my saying.
Let's put that on a bumper sticker. Thank you, Dr. G.
Good to be here, Kathleen.